So how did it go? How many of you guys enjoyed the little exercise? And you learned a little something? Okay. Well, that's the idea. So when I was walking around the room, there were a variety of different conversations. And some of them, they were easy, right? They said they wanted to do something. Then the other person, well, yeah, I think you should do that. Here are the benefits, all of that. And then it was just kind of done. So that's fine. You're listening, you're talking. But then you want to reframe it in a way that makes them think about, so for example, and I'm not going to point out which group, but you know who you are. The group in the back. No, so let's say you want to lose some weight. Great. So as the listener, I say, I think that's a great idea. There's a lot of health benefits. You can lower your blood pressure, decrease your risk of developing diabetes, just all of these good things, right? And we, if they didn't know that before, they know it now. But the other important side of that is, let's say that it's someone who has diabetes, right? And you say, well, yeah, lose some weight, you can decrease your risk, maybe cut back on your anti-diabetic medication, be healthier overall, and all that's fine. But you also want to reframe it this way. Okay, well, if you can't lose weight and you miss your goal or you can't commit to making these changes we've just talked about, what are some of the things you're afraid of? What are some of the issues revolving around your disease that worry you? And you want to do that because you don't know what they know about their disease, right? And you won't know until you ask them the question. So you always want to reframe it back because remember, they want to have to make the change. They need to think about it, and you need to figure out what motivates them. So by asking that question, they're going to tell you what they're afraid of. They're going to tell you what they know about their disease, and that helps you figure out how to proceed on with the motivational interviewing. Because if you just stop with, oh yeah, that's great. I think losing 5 pounds would be good. That's not really helpful, right? That's not really motivating them because everything that they told you, I want to lose weight because I have diabetes. Yeah, we know that. Yeah, that's great. You know, we've given some information. But what you really want to know is what in the back of their mind makes them want to make that change, right? So, yeah, someone wants to lose weight, but why? What's their true motivation? And you can't find that if you don't ask the questions. So, and I just had this up there while you guys were doing that exercise, just kind of to refer back to if most of your conversations were all positive, no one argued, because you guys had real good ones, no one can really argue, no, I think you need to put on 15 pounds. So I didn't hear that going on, but in those type situations, that's where these kind of come out a little bit more. So ultimately, motivational interviewing is a semi-directive, client-centered counseling style that enhances motivation for change by helping the client clarify and resolve ambivalence. So that's where those discrepancies come in. So when they're ambivalent about making the change, you find some kind of discrepancy that makes it so, well, you know what? I have to make the change because if I want this or I don't want this, then I have to do this. Does that make sense? So the easiest thing is I just refer back to if I don't want lung cancer, I should stop smoking, right? So the goal is to create and amplify that discrepancy and get them from where they are today. And remember, I talked about it's not always this straight line like you see in the picture, but you're going to get them from where they are today to where they want to be in the future. And where they want to be might not always be where you want them to be, but you're always going to be their biggest advocate and cheerleader. You want them to go beyond what they think they can do, but your main goal is to get them where they want to be. So those 4 basic principles, you're going to express empathy, develop that discrepancy, because you can't develop the discrepancy if you haven't empathized with them and kind of developed that rapport. You're going to roll with resistance, and we're going to talk about that in the next couple slides, what you do when it's just, they're resisting everything you're throwing at them, everything you're talking. You can't crack them, you can't develop that. Their wall is this high, and you can't take one single brick off. And then once you do start breaking that down, you always want to support their self-efficacy. So whatever they're doing that's getting them going in the right direction, you want to support that thing. You don't want to give them some other lofty goal that might derail their current progress. So empathy reflects an accurate understanding. And there's just a picture to kind of differentiate between sympathy and empathy. So sympathy is, yeah, you've got your hand on your back. Yeah, I understand. I'm here for you. Empathy is giving them a hug, saying, I'm here for you. I feel what you're going through. So why is empathy so important? It's that first thing that cracks that hard outer shell and those walls that they put all around themselves. So it's that first thing that gets you your first little foot in the door. It communicates acceptance, and when you're working with a population that's been looked down on and stigmatized and turned away, you've got to empathize and communicate, I accept you for who you are, what you've been through, what you've come from. You're here today, and I'm here to help you. Encourages a collaborative alliance, which also promotes change. So you guys are in this together. Their success is your success. When they're happy, you're happy. When they're stumbling and they're sad, you feel the same way because you're in it together. You're a team. Leads to an understanding of each person's unique perspectives. And this is important because my perspective is going to be different than your perspective. And it doesn't matter who we are, we have different life experiences. So we're not always going to see things through the exact same lens. And you have to be aware of that and cognizant of that. So change is difficult. Not changing could be fatal. And we see that with the opioid epidemic. We see that with chronic diseases. So when it comes down to it, that statement in and of itself is one of those coercive type things. If you don't do this, you're going to die. That's not what we say. We might know that to be the case, but we're not going to do that because that puts up those walls and it's not helpful. So that's more of an example of what not to say when you're working with someone. Because guess what? Someone who's an injection drug user, they already know that. Trust me, they know that. They don't need you telling them that. So some tips. And for me, this is easy because I didn't grow up with all these electronic devices, and I had to look people in the eye, and I had to say, yes, ma'am, yes, sir, all of those things that I try to teach my kids. And my oldest, he is awesome. He is the people pleaser. He gets good grades. He does his homework. He tries hard in everything that he does. But this is how he talks to people. He'll go up. I did great in baseball today. I'm like, you have to, Max, I can't even hear you. You've got to look at me. And then he'll look at me and he'll say it again, and it's fine. But it's almost like his neck is like this. So that it's like they're not used to looking up at people and seeing their eyes. And I see it because I'm on campus a lot, and it's like the new uniform. And this is weird. I'm walking around, and the girls have T-shirts on that come down to here, so you can't tell if they've got pants on. And every one of them's like this. Every single one of them. Come on. So it's just one of those things. So eye contact, if you're not looking at someone's eyes, you're not connecting. So you've got to have good eye contact. You've got to be responsive to their facial expressions. So if they grimace or wince, you need to respond to that. Because if you don't, guess what? You don't care. So you've got to respond appropriately. And sometimes that takes practice. And if you're not really empathizing, that's where that comes out. That might be sympathy. So when you're empathizing, it's easier to respond to these things because it's more natural. Because when they're feeling pain, you're feeling it too. Body orientation. So I'm not like Kyle back there like this, right? That closed up posture. You want to be open. You want to be receptive. So you don't want to be confrontational, wear relaxed clothing. When I'm going out, look, I've got a polo on today. I'm not in a suit and tie, right? That wouldn't help me. Would that help me give this presentation to you guys? Would you guys receive me better if I were dressed in a suit and tie? No. So you've got to dress to your audience. You've got to know your audience. You've got to know who you're working with, because a lot of times just how you look will put up the wall before a word comes out of your mouth. Automatic. So it's that verbal and nonverbal. So what you do and how you act says a lot before you even say anything. Reflective listening, asking those clarifying questions. So when you're talking to people, you always want to reframe it back so that they know you're listening, that you're on the same page, and a lot of times you're going to do that reflective listening and ask them hard questions. Like with the diabetes, yeah, you should lose 5 pounds, but if you don't do that, what are some of the things you're worried about? Avoid expressing doubt, and definitely don't pass judgment. So when you're working with people, specifically with the substance use disorder, they've got a lot of self-doubt already, right? You probably wouldn't be working with them. That's hard for them to probably even talk to you. So if you're expressing doubt in their ability to change or your ability to help them on their journey, that's just not helpful. Even if you're feeling that this might be a really tough case, that they're in a really bad place, then you know what you do? You go back and you bring all of your resources and you collaborate and you find someone who can help. And you tell them that. You've got to be honest. You got to say, look, I'm going to do everything that I can to help you, but I've got this. I'm going to connect you with this person. They've got just what you need. And I'm going to, you do the warm handoff, you introduce them, you get them set up. But if you can't help, bring all of the resources you have to bear to get them the help that you need or that they need. And that you need, because if you can't do it yourself, you're not helping them, right? So admit it when you're in over your head. Current behavior versus future goals. So that's that discrepancy. We've talked a lot about that. So that's when they're saying it doesn't add up, right? 1 + 1 is 2. 1 + 1 is not 3. So you develop that discrepancy, and when you show it to them like this, it makes sense, right? So whether it's high blood pressure, heart disease, alcohol use disorder, opioid use disorder, anything, it doesn't matter. There's certain steps that they can take to slow the progression or stop the progression of their current disease state. And they know that, but you've got to develop that discrepancy in their mind so that they can see it like this. 1 + 1 is 3. Everyone knows smoking causes cancer. Everyone knows that IV drug use can lead to bloodborne infections and potential overdose and using opioids, and we've got all the fentanyl now. Trust me, people know this, but they still do it, right? And part of that's because it's a chronic neurological brain disease, but the other thing is they can't see it themselves because they're in it. So you've got to develop that discrepancy. Current behavior, and it's always current behavior versus their future goals. How do you know what their future goals are? By asking them those questions, by listening, by figuring out what motivates them. Change is motivated by a perceived discrepancy between present behavior and important personal goals or values. So I've got values bolded there because the values that they have and the things that they put importance on, that's going to be your hook. That's what you're going to latch on to. That's what's going to help you get them to understand why they want to make the change. So if those values aren't identified, there's no discrepancy. So you've got to figure out what's important to them and frame it in a way that if this is important to you, then this can't be part of your life. If you want this, and this is the most important thing for you, then these things over here are going to make it impossible for you to get there. So you've got to develop that discrepancy in such a way that they can see and see it clearly. So some basic values. What makes their life worth living? And a lot of times, they'll be in a really bad place. And the first couple times you talk to them, you might not be able to even get that out of them because they're in such a bad place they don't see anything else, right? But there's always something. And by you being there and getting them to open up, they'll eventually give you a glimpse of something that's important to them, and then you latch on to that, and that's what helps them climb up out of that hole that they're in. So what gives their life meaning, what's important to them, all of those things are what you're going to be developing in your mind, in your plan, by listening to what they're telling you. So areas of values. So these are just some common ones that you'll see, and I expect to hear from most people. So family's a big one. Intimate relationships, friends, social connections, work, education, recreation, spirituality, citizenship, health, physical self-care. Those are some common things that people care about and they put a value on. You always want to ask them about their concerns. So in that example with the diabetes, what concerns you about your disease? It doesn't matter what it is, opioid use disorder, alcohol, what concerns you about what you're currently struggling with? Because that will give you a baseline on what their baseline knowledge is of their own disease. You want to provide non-judgmental feedback and information. So if, let's say, come up with an example that's not vaccine related. I'll come up with one in a minute. Watch for signs of discomfort with the status quo. So just because it's right for most people doesn't mean it's always going to be the right thing for who you're working with. So try to stay away from that and try not to frame them in the context of what most people do or what other people do, because that's not going to be helpful, and that might cause them to start building that wall back up, because they're probably not like everybody else. And I promise you, if you're working with this kind of patient population, they already know that they're not like everybody else. And that's why they're looking for help. And yes? First thing you say, that's okay. That is a natural progression of the disease of what you're going through. And I expect that. So tell me about what happened, and we'll just go from there. So it's easy. The first thing you say is it's okay. Because guess what they're feeling? Guilt, shame, they feel like a failure, and you don't want to magnify those feelings, because trust me, they're already feeling it. They already know that. So the thing is, they shouldn't feel that way. When patients come in and they haven't picked up their metformin in months, I don't say, you know what, I'm not giving this to you because clearly you're not taking your diabetes seriously. I don't do that. So we shouldn't do that with other things, right? And so to answer your question, the first thing you should say is, it's okay. Let's figure out what happened and then just go from there. Because they already feel bad enough.
Can I give an example?
Yes, please.
I have a specific young lady I've been working with for a long time. She had 6 months and then went back on a real bad relapse and started coming back to the ministry that we were in, and she kept away from me for a good while and knew, but you could tell she wanted to talk. So when I finally talked to her in the parking lot, she's a big hugger. So when I finally saw her in the parking lot, I hugged her and I said, "I'm so happy for you." And she said, she pulled away and she said, "What are you talking about?" And I said, "Relapse didn't take your life, and it could have. I'm so happy to see you that this relapse didn't take your life, because that's where we could have been. Now, where do we go? Where do you want to go from here? And how can I help you?" And you just felt all the shame just kind of like, he's grateful that I'm alive. So what am I going to do about that? And it just completely flipped the script with it.
Thank you. I'll be using that example in the future. I'll give you credit.
No, you're good.
So, and that was great, because that is I'm going to go out on a limb and say that's the most common thing that's seen in any treatment scenario. I don't know. I haven't worked with anyone who hasn't had at least one relapse. I haven't personally. The stats say the highest would be maybe 85%. Well, the people I work with, I haven't worked with anybody who hasn't had a relapse.
You just relapsed on Chick-fil-A.
Yeah, see? I just relapsed on Chick-fil-A. I mean, relapse is part of recovery. It is part of it. And if you think that it's not part of recovery, you're in the wrong job, you're in the wrong business, because it absolutely is. And you have to be accepting that relapse is going to happen. Because if you're not, trust me, they already feel bad enough about their relapse. But that's a great question, and I'm glad we had that conversation. And then always ask this question: what role, and you don't have to phrase it exactly this way, but what role, if any, do you think whatever it is that they're struggling with play in your health? And then you always want to let the patient decide. Remember, you set the guidelines and the guardrails, and you let them work within those. And then a lot of times, simply asking them helps. You might be the first person that's just ever asked them, "How do you feel?" Right? So just asking these questions and showing them that you really care about what they're going through is going to be really helpful, and it's going to be therapeutic. Now, I'm not a therapist, but this is going to help disarm some of their fears and those walls that they've put up, right? And that's the whole goal, to get to know the person so that you can find what motivates them, find that hook, nurture that, and then they'll come to their own realization of why they need to make that change. So readiness to change. We always have to have some kind of gauge or some kind of metric so that we know where people are. So this is just easy. It's just like a pain scale, 0 to 10. So 0 to 3, they're just not ready. 4 to 7, they're in that kind of ambivalent stage. Well, I could change, I can maybe not change. And then 8 to 10, they're pretty motivated. They're ready. Now, very few people, when you start with them, are going to be in the 4 to 10 range. Because if they were already there, they probably wouldn't need your help that much, right? But most people at the start are going to be in that not ready stage. Some of them might be ready, but they don't, there's no discrepancy there. They're still really ambivalent. So you want to reinforce the positives. So, for example, well, you marked a 4. That's great. This means you're 40% ready to make the change. So why did you choose that number and not a lower one like 1 or 2? And in this situation, what's ideal is they tell you what you already kind of know because you've dug through those layers of the onion, you've figured out what motivates them, and they're going to tell you those things. So if you figured out it's family or it's their health or whatever it is, they'll say that's the reason. Does that make sense? So if they're going up on that scale, the reason they're not lower is because they're seeing the discrepancy. They've chosen in their own mind why it's important to make the change, and those are always going to be back there pushing them forward. So we're going to do some practice. So in your packets, not the slide, the other one, the last 2 pages, you see those? So it's 1 page front and back. Or wait. The very last page is the last page is the answers. So the page before that. Yeah, so don't look at the answer page. So that's working on open-ended questions. So you guys can do this together, or you can do it separately. It's probably more fun if you guys just kind of work through it together. But it's a whole list of closed-ended questions, and it's just practicing reframing those exact same things into an answer that they can't just say yes or no to. So it's going to make them think, and you're going to get more information. So we'll just take, there's a lot of them there. We'll just do maybe 3 or 4 minutes on that. You don't have to get through them all. The answers are on the back. I just want you guys to work through this together and bounce some of those off each other. And if you get stumped, ask me. But don't look at the answers. So how did that exercise go? So good practice? Did you guys learn some things? So that's what it's all about. So with this part of motivational interviewing, this is something that you can practice every single day. Your open-ended questions. And I promise you, your relationships with your friends are going to get better. With everybody, because guess what? You're going to start learning more. You're going to have real conversations. Now, if I want a quick answer, and I don't do this all the time, I'm going to text because I just want an answer. But I'm still old-fashioned. I like to call because I don't always know where the conversation's going to go. And if you do a text, it can only go one way. It's going to stop with an answer to that text. And I like conversation.
Best open-ended question to ask your wife. Where do you want to eat?
Can I interject on
Yes.
This is what you do. Guess where I'm taking you? And whatever she answers, take it with.
Oh, that's a good one. Oh. Motivational interviewing is not tricking. So you've done all this, and this is all high level. This didn't dig really deep into any one section, but now you're ready to go. You've got them ready to go. So you got to create that action plan. And what are some options and steps that will work for you? So you always want to start asking them for that information before you offer anything. One really good example that happens to me all the time at the pharmacy, and it's happening less and less because controlled prescriptions have to be e-scribed, so there's a lot of e-scribing, so that takes out a lot of the guesswork on handwritten ones. But we still get them. So my rule is, if a technician doesn't know what something says, they absolutely cannot bring it to me and tell me what they think it is. Because as soon as they do that, that's what I see. Yeah. So they bring it to me, they don't say a word, and then I tell them what I think it is, and they go, oh, yeah, that makes a lot of sense. Or they say, oh, I thought it said this, and then we can have a discussion, and then we end up calling. Because when it gets to that stage, but that's the rule. You can't tell me what you think before I have a chance to think on my own, because then your thought's in my head. So I don't want to know what you think that prescription says, because I promise you, as soon as they do that, that is all I can see. When I hold it up, I'm like, dang it, I wish you hadn't told me that. Yeah, I see that, but that might not be what it is. So you want to start with what works for them, and then start talking about what might be realistic or what might be a stumbling block for them. So what do you think you can do to stay healthy and safe? You just want to ask these basic questions. And then you're going to identify, and hopefully that by this point, you know what their strengths and weaknesses kind of are. So that's when you're going to help them. So you're going to help identify those, and that might modify their action steps in their plan. But you want them to come up with the initial stages and steps, because this is about autonomy. And they're going to tell you what they think is going to work, and then you're going to work with them on that. You can modify it, absolutely, but you want to give them the first go at it. Rolling with resistance. So the patient, I don't plan to quit drinking anytime soon. So you could say, you don't think that abstinence would work for you right now. Right? You're rolling with it. Okay, I accept that. You just don't think that it's going to work for you right now. My husband is always nagging me about my drinking, always calling me an alcoholic. It really bugs me. So you reframe it into something positive, right? You're always trying to keep the conversation going. Well, it sounds like he really cares about you and is concerned, although he expresses it in a way that kind of annoys you and pisses you off. So you heard what they said, you acknowledge that it upsets them, and then you framed it in a way that it's a positive that he's nagging you. It's because he cares. But you didn't discount the fact that it makes her mad, right? So you want to just that's what rolling with resistance is. You don't overtly discount what they say. You just don't, well, he cares about you. It shouldn't make you mad. Well, that's not what she told you. She said it makes her mad. So acknowledge that. And then that little cartoon there. It's good to see it. At least one employee has overcome her resistance to change, and that's the Wicked Witch. I'm melting. Rolling with resistance, this is kind of like those other slides. It just kind of puts the things into buckets. So an argument, it's challenging, discounting, hostility. So just kind of breaks all of those out. Some very common things that you'll hear. Look, I don't have a drug problem. And you can just say, okay, so drugs aren't affecting your day-to-day life currently. Or you could say, okay, how do drugs fit into your daily routine? So you just open-ended questions to get some more information. My cousin was a druggie. I'm not like her. You could ask, well, tell me a little bit about your cousin and some of the struggles that he or she went through. Because then it's going to make them think about what they saw them go through, and then it's going to frame it in such a way, oh, that could happen to me. I can quit using anytime I want to. Yeah, right, like I could resist the chicken minis. If it were that easy, no one would have there wouldn't be any people overweight, there'd be no heart disease, there'd be no substance use disorders. So it's not just that easy. Oh, I just do it on the weekends. That's me, football. Weekends in the fall. When you're a UT fan, it takes more than 6 beers in a setting to get you through it. So, but that's only on the weekends, and it's only certain months in the fall. I can stop anytime I want to. Everybody uses drugs these days. Well, as a pharmacist, I would say, well, that's not far from the truth. Everybody's on something. But that's not what that means. That's recreational things. And our border neighbors, Virginia, recreational use of marijuana for anybody who wants it. And we know it's here. So I'm not worried about any of us. We have fully functioning frontal lobes, and I've got the willpower to say I've had too much pot today. But an 18-year-old doesn't have that, right? So it's dangerous stuff. I can't handle going through withdrawal. I mean, that's a valid concern for a lot of people, especially with opioid use disorder. You feel like you're going to die, but you're not. Now, alcohol use disorder is different. You might die. That's absolutely an emergency situation. Same thing with withdrawing from benzodiazepines. If you've been on the max dose for years, if you just stop, that could be fatal. So, I mean, you can validate that with them. If that's one of their concerns, you can say, I agree with you. Withdrawal could be deadly for you depending on what drug it is. But then you work on ways that they can mitigate that.
So what, going back like to the, I can quit using any time I want to. So then what would the correct response be to that statement? Because we hear that all the time.
Yeah, so I just say, well, when was the last time that you went without it for any extended period of time?
Okay.
And then they would say something, and then I'd say, what caused you to go back to use? And all you're doing is you're just getting more information.
Okay.
You're not saying that's the right thing, that's the wrong thing. You're gathering information. Because every conversation you have with them, and when you give them the chance to tell you that, basically what you're telling them is, okay, I believe you. Just tell me about a time that you did stop.
Okay.
Right? Because if you just completely discount it, you know what they're hearing in their mind? Well, he doesn't think that I can stop. So you make them think about the fact that they say they can stop anytime they want to. Well, tell me about the last time you went for any significant amount of time without it. But great question, because I mean, that's one of the most common. So everything on this list, you're going to hear it. Okay, so a lot of times you just have to let it go. And I promised you guys we'd get out of here on time, so I'm going to go quickly. So I'm not going to push you to change anything you don't want to change. And that just needs to be a fact. You're not pushing them. We've talked about this, it's motivational interviewing. And if you hit that hard wall and you keep pushing, that's not going to open that up anymore, right? So you just move on to the next thing or focus on something else. You can always circle back to that, but you don't just keep. I'm not here to convince you that you have a problem. Most of the time, they already know they have a problem. They just haven't admitted it really yet or verbalized it out loud, and that's your job, to motivate them and find a way to develop that discrepancy so that they realize that they may not think it's a problem, but when you frame it in the context of where they want to be versus where they are now and the steps to get there, that's when it starts making more sense. I'd just like to give you some information. So with vaccines and vaccine hesitancy and all that stuff, I just give people information. I don't tell them you should get the vaccine, you should not get the vaccine. I give them unbiased facts and let them make their own decision, because if I'm trying to force something on them, that's not going to make them want it anymore. I'd really like to hear your thoughts about. So that's another thing. So when they say, hey, I can stop anytime I want, you could say, well, I'd really like to hear your thoughts about maybe trying to stop for the next month. What would you feel? How would you feel about that? What you decide to do is up to you. And that's a fact. It has to be, or none of this works. We've talked about open-ended question, affirming, reflections, reflecting back what they've said to you. to make sure that you guys are on the same page and those summaries. So just acknowledging everything that they've said. More open-ended question examples. And that's it. What questions do you guys have? And that was a lot of information really fast. But I'm happy to answer any questions that you guys have. And so that's my oldest, Max. My middle child is on your right. That's Wyatt. And the little dude just turned 2 in June. And then that's my wife, Jennifer. She is a hospitalist physician at Blount Memorial in Maryville, where we live. Well, I thank you all for your time and attention. And I'm pretty sure we've got some evaluations and surveys, so we always appreciate your feedback. That's a necessary process. We've got to get that information to keep grant funding like this going. And it also helps us tailor programs and offerings to your specific needs. So if there's something that you'd like to hear more about, or something that you'd like our Corp to cover, or Project Hope, or Project Now to help you guys with, we will. With that, I'm done.